Everybody, this is Dr. Robert Caridi from the Austin Gynecomastia Center, and I think I have a nice case for you today. This is a young man. He's a 15-year-old. He's brought in by his parents. His parents did all the bringing of the patient in, but the patient did all the research. So he's the one who actually spent a lot of time on the internet, and that's how he ended up here. So kudos to him for kind of doing what I think is a good job of finding someone with the most experience to treat gynecomastia. Okay, so he's overweight, we know that, and part of the thing that I'm going to really drive home to him is get his shoulders back and get him to lose a bunch of weight. You can imagine as a 15-year-old, he's pretty tortured by this, and it's affected him a lot. It's probably 100 out of 10, and you know, he's emotionally probably not where he needs to be. His confidence is lacking, his self-esteem, the whole gym thing, the whole taking off the shirt. So the moral of the story is that although we just talk about this as his gynecomastia, the way it affects his head and the way it's affecting his life is the big deal. I mean, that's just the bottom line here. So everything that I do to affect anybody's improvement, yes, the visualization is a lot in terms of success, but it's really, it's the mind, and it's really to try to clear this up so he can really be the young man that he needs to be. But what you can see clearly here is he's got ptosis. Ptosis means that his nipple areola complexes sag. They're pointing downwards. He has some lax tissue, and the thing that he came into me and asked me for was removal of the tissue and smaller areolas. Now, I'm not going to profess to know everything in the world and to be the best in the world and all this kind of stuff, but I can tell you if you went to most ordinary plastic surgeons for this kind of treatment, other alternatives that you'll get in terms of a recommendation would be to cut this whole area out and leave him with a scar that goes from his sternum to over here. That's one thing they would do on both sides. The other thing they would probably recommend is an incision around the areola to make the areola smaller. So I think that is a possibility, but I think that what I've learned over the years of doing this in the thousands of cases that I've done is that I believe in the ability of the skin to contract in his particular case, and I believe in his youth. I mean, he's 15, so that skin is going to go back. And if I can avoid the sort of pizza pie incision around the areola, I think that's a good thing. If I can avoid a scar across his chest, I think that's a great thing. And probably more pertinent is if I can do what I can do and get away with it, and he has neither one of those, and that's a total home run, right? I can always go back and do these other procedures if I need to, so I'm kind of keeping all my options open, and there's also less risk of the nipple areola complex dying or turning black if I kind of do my alternative. So moral of the story is that I'm done with his case. I didn't really know what I was going to do. I had all those options in mind, but what I did was a little bit more unique, and hopefully I'll show you this on his case here today. So my videographer is going to zoom in here, and I'm going to come by here, and let's just take a look. So he's done, and these are small incisions I made here for the liposuction, and I contoured all three zones. So my zones 1, 2, and 3. It's important to know the zones because that's the way we get to communicate. So all three zones were done, and had only a small incision around the areola, and the areola is already contracted nicely, so look at the size of it. It's already small. I had no question that that was going to get a lot smaller. This plication or pleating suture that I have up here basically grabs all the skin that was clumped in this area here, and I spread it out, and I brought it up. So his new nipple areola complexes are way above his inferior fold, which is down here. And if I can get this to stay here, and if I can get this relatively smooth, I think all of us would agree that this would be an absolute home run, and that's what I'm hoping for. As I told his parents, you know, I didn't do this case this way because I just wanted to. This is what is best for him, as if he was my own child, and so, you know, this is what my kid is going to get. So that's why I did this and didn't hesitate. And I'm hoping for the best, and hopefully I can get back to you on how he did in the near future. For the record, my nurse will put up the stuff we got out of him. That's the meat sort of portion of him. So he has what I call fibro, glandular and fatty combination here. So as opposed to a big clump of gland white stuff, he has white stuff that's intermingled with fatty tissue and fibrous tissue. So He's more of a fibro glandular tissue, and it's bigger on the left side than on the right side. And again, did a lot of liposuction here to even it all up, and that's pretty much it. So I just think it's an interesting case because it's more challenging in a lot of ways, and I know that you guys are actually amazing in your ability to learn what I learned and understand that, and I think that's really kind of cool. So that's why I spend a lot of my time helping you. So if you're, a lot of my patients are from all over the world, and this way my patients can really kind of look at my philosophy and where we're trying to go and what we're trying to achieve. And I don't get all crazed out about the little incisions around the areola and all the nonsense that you'll hear from all these other people kind of trying to sell you. I'm not trying to sell you, I'm just trying to tell you how I do it and how I get the results that I do. And I know you learn, and I appreciate you considering the Austin Gynecomastia Center, and certainly appreciate all the video watching that you all do. So it's all great. Have a nice day, and if you have any questions, please don't hesitate to contact the Austin Gynecomastia Center. Thank you.